Hello and welcome back to my video series on understanding the evaluation of abdominal pain in the emergency room. If you've not seen part 1 in this series, hang around to the end of this video because there's going to be a link for you to use and find that video and watch it. And I really encourage you to do so because it has a lot of great information in it as well. If you are someone who is unfamiliar with the medical community, or maybe you are, but you're having abdominal pain and you're really curious about what could be causing it. And especially if you go to a medical provider, whether that's your doctor or if it's in urgent care or the emergency room, what are the thought processes that we go through as medical providers in those areas? What are the thought processes that we go through in trying to help you to determine what's causing your pain? My name is Andre Huey, and I am a physician assistant. I work in the emergency room taking care of patients, and abdominal pain is a complaint that I see a lot of in the emergency room. I have over many years now. So I think it's very important to understand and to hear some of the conditions that could be causing your discomfort. In general, when you're talking about abdominal pain, there are a lot of conditions that can cause you to have discomfort in your abdomen. For both men and women together, there are about 20 different things that can make you hurt in your abdomen. Now, that's a list that I came up with that may not be all inclusive, but it's pretty close. For women, there's those 20 things, and then there's about 4 more because you have more organs, right? You have your uterus, your ovaries, your fallopian tube. So for women, there's about 24 things that can cause you to hurt in your abdomen. And if you're a pregnant female, there's about 26 things that can overall make you hurt in your abdomen. So that just goes to show you how complex it can get and how very important it is for, number one, if you're hurting, to get checked out, for a medical provider to evaluate you. It's very important for we as medical providers to have a really good understanding of the abdominal anatomy and have a good thought process as well as a good examination process when you're chasing down discomfort in the abdomen to help the patient out. So on this video, part 2, I want to tell you about how we divide the abdomen into 4 quadrants, which helps us during the examination process to zero in more on what could be causing your pain. And then I want to, on this video, to zero in on what we call the left lower quadrants in your lower abdomen to the left of your umbilicus, a little bit below that. If you're hurting in that area, then this video is going to help you. So to divide the abdomen into 4 different quadrants. Very simply, if you, and this is an imaginary line obviously, if you put your hand, let's say put your finger on, let's just for simplicity say the left side of your abdomen, even with your umbilicus, but on the left side, your belly button, and you draw all the way across your abdomen to the right side, but in that process you go through your umbilicus. It's a straight line. That divides the abdomen into 2 sections, an upper abdomen and a lower abdomen. Above that line is the upper abdomen, below that line is the lower abdomen. Now, if you put your finger just under your sternum bone and you go straight down through the umbilicus or the belly button, and below that, that divides the abdomen into a right side and a left side. So ultimately, it divides the abdomen when those 2 lines intersect at the umbilicus or the belly button. It divides it into 4 quadrants, and that's how we examine you and determine where you say you're hurting, and then when we push on your abdomen, where are you actually physically hurting. And that helps us to zero in on what are the potential or likely causes of or conditions causing pain in that area. Now I want to zero in on some conditions that can cause pain in your left lower quadrant on this video. And I'm going to cover those items. Now I might mention on a few of them some of the generalized treatments that go along with that, but for the most part, I'm going to defer any kind of treatment to the medical provider that's seeing you, should you be somewhere being evaluated for that, because there's a lot of other factors that go into it. So let's jump right in. The first thing that can cause anyone pain in the left lower quadrant is constipation. Now, we all know what that is. It means you need to poop more, and that can cause pain if you're getting really backed up. Now, your medical provider is probably going to recommend that you increase your fruits, your vegetables, your fiber intake, fluids, and they're going to recommend that you are more active. Activity helps to stimulate our bowels. It keeps our gut in shape, keeps it healthy, which in turn helps with bowel movements. And if it's severe enough, they may recommend some medications, whether over the counter or prescription, or maybe some enemas. But again, I defer that to the provider that is seeing you at that time. But that's constipation. The next thing that can make you hurt in your left lower quadrant is something called diverticulitis. That is when you have an infection in your colon. It can happen anywhere in your colon, but the most common area is in that left lower quadrant. Diverticulitis is when pockets that develop in our colon over time due to extended exposure to pressure, they're outpouchings or pockets on the outside of our colon, it's when they get infected. They cause inflammation and pain, and typically, in an uncomplicated case, it's typically you go home with clear liquids, pain control, and antibiotics, and then close outpatient follow-up. There are some situations where people with that do need to be admitted. They might need to have surgery as well. But again, I defer that to your situation and the medical provider that is seeing you and treating you at that time. On to number 3. The next thing that can cause pain in your left lower quadrant is musculoskeletal pain. That's basically, you could have pulled a muscle, or maybe you have a pinched nerve, a bulging disc in your back, and that pain is radiating around to the left and making you hurt on your left side and your left lower quadrant. So that is musculoskeletal pain. Number 4, colitis. That can be an inflammation or infection in your colon, and that is determined by your medical provider after they look at your history. They do a physical exam on you, they look at your blood work, and they look at your imaging. That will help them decide what your treatment plan will be when things point them in more of an inflammatory versus infectious result or cause of your discomfort. The next thing that can cause pain in that area is something called a shingles rash or a zoster rash. That's a painful, itchy rash, raised rash that can happen on one side of the abdomen that comes from a herpes virus. And that virus ultimately comes from a chickenpox virus. The chickenpox, if you had it years ago, that is a herpes virus that never goes away. It goes to sleep in our skin, and then it wakes up down the road for whatever reason, and it comes back in the form of a very painful rash. And that can be treated with pain medicine, sometimes antiviral, sometimes with steroids. But again, I defer that to your primary or the provider who is seeing you at that time. You could be diagnosed with irritable bowel syndrome or IBS if you're having pain in that area. That is a functional bowel syndrome. It means your bowels are a lot more sensitive to things, which you're a lot more sensitive to pain, and therefore it can cause a lot of discomfort in that area. Someone could have a urinary tract infection causing pain in your left lower quadrant, and a lot of times that's treated with antibiotics and pain control. You could have a kidney stone. That's when you have a stone in the actual kidney that drops out into the tube, the ureter, going from the kidney to the bladder. And as that stone, that little tiny rock, is moving, it causes significant pain, and that pain could be in your left lower quadrant. Hernias can cause discomfort. Hernias are weaknesses in the abdominal wall that allows intra-abdominal fat or the intestines to start pushing through that weak area in your abdominal wall due to intra-abdominal pressure. and that can cause pain, and it's up to your primary doctor that's seeing you at that time to determine the actual treatment plan. Do you need emergency surgery? Do you need outpatient follow-up with a general surgeon to address that issue? There are some conditions where you have specifically inflammation in the tissues in that area, whether it's the lymph nodes or just the tissues that line the abdominal wall or that line the intestines. You can have inflammation in that area, which in turn can cause pain in the left lower quadrant. STDs can cause pain in that area as well for men and women. For women, if that STD or sexually transmitted disease goes untreated or is severe enough, it can cause your uterus and your ovaries to become inflamed along with your fallopian tubes, and that condition is called PID, or pelvic inflammatory disease, and that is very, very painful. And these last conditions strictly affect women. So the 12th thing that can cause pain in the left lower quadrant is something called discomfort of pregnancy. If you're pregnant and you're diagnosed with discomfort of pregnancy, it doesn't mean that there's necessarily anything wrong. It just means that your body's changing because you're pregnant and you're having discomfort because of these changes. The 13th item is something called ectopic pregnancy or tubal pregnancy. You can have pain in your lower abdomen from that, and the left lower quadrant is one area that can hurt. That is a life-threatening emergency for the mother. It's very important to be diagnosed, and the provider seeing you at the time will diagnose that through blood testing, examination, and ultrasounds, and then ultimately consult a GYN specialist to find out what the best course of treatment action is for you. Sometimes a female can have an ovarian cyst, a cyst that grows on your ovary, and your ovaries are on your right and lower quadrant areas. So that is something that can make you hurt in your left lower quadrant, and that is diagnosed through examination, ultrasound imaging. Sometimes those ovaries with a cyst on them can twist, and that can cause a decrease or a loss of blood supply to that ovary. That's called an ovarian torsion, and that is a surgical emergency. Again, diagnosed through history, examination, and ultrasound, where they look at the blood flow through that fallopian tube to the ovary. And if that blood flow is missing, then they will consult a GYN surgeon to address that issue. The last item that can cause a female to hurt in the left lower quadrant is something called a uterine fibroid. That is a benign tumor that grows in your uterus, and they can get pretty large and they can cause pain in that area. So those are some really common things that I have seen over many years of working in the emergency room taking care of patients. They can cause pain all across the lower abdomen, but we're focusing on the left lower quadrant during this video. It's really important to get knowledge ahead of time. I think that really helps folks to understand things more when they go see their medical provider. That knowledge ahead of time reduces anxiety. It helps you to understand things better and ultimately helps you to be healthier down the road, because if you understand things better, then you're more apt to be more compliant with your healthcare treatment and thus be healthier down the road. So thank you for watching this video. Check out links that are coming up to other videos that I've made. Please subscribe to this channel, like and share this video with your family and friends, as they also can benefit from this information. Thanks for watching to the end, and take care.